In a move that sent shockwaves through the public health world, Dr. Susan Monarez was abruptly ousted as director of the CDC, an event that few saw coming and even fewer could immediately explain. Her departure came less than a month after she took office, a tenure so brief it left many wondering what could have gone so wrong, so quickly. The announcement wasn't made in a press conference or official statement, but through a terse social media post, leaving both CDC staff and the public scrambling for answers and clarity. Dr. Monarez's time at the helm is now the shortest in the CDC's 79-year history. Most employees barely had a chance to meet her, let alone understand her vision for the agency's future. Her sudden removal has created a leadership vacuum at a time when the CDC is facing mounting internal challenges and intense scrutiny from the outside world. According to her legal team, Monarez did not resign, nor was she formally fired. Instead, she was pushed out for refusing to comply with what she described as unscientific, reckless directives from higher authorities. This episode highlights a deepening rift between those advocating for evidence-based public health and those seeking to impose political agendas at the highest levels of government. Her ouster has ignited a national debate about the CDC's independence, the integrity of its science, and the dangers of political interference in public health decisions. Across the country, experts and citizens alike are questioning what this means for the future of the agency and for the nation's ability to respond to health crises. The agency's reputation, already tested and strained during the COVID-19 pandemic, now faces even greater erosion and uncertainty. For millions of Americans, this controversy isn't just about politics or bureaucracy. It's about whether the health guidance they rely on is truly based on science, or if it's being shaped by something else entirely. The CDC's stability and credibility, so vital to the nation's health, are now in serious jeopardy, with the path forward more uncertain than ever. Dr. Monarez's rise to CDC Director was historic. Her appointment marked a turning point for the agency and for public health leadership in America. She became the first CDC Director to be Senate-confirmed under a new law, a reform designed to protect the position from political interference and ensure that science would guide the nation's health decisions. Yet, her confirmation was razor-thin, with the Senate deeply divided, an early sign that the CDC's independence would soon be tested by partisan forces. Behind the scenes, tensions quickly escalated between Monarez and HHS Secretary Robert F. Kennedy, Jr., as both leaders clashed over the future direction of the CDC. The core dispute centered on a fundamental question: should the CDC's vaccine recommendations be determined solely by scientific evidence, or should political considerations play a role in shaping public health policy? Monarez stood firm, resisting mounting pressure to alter the agency's rigorous immunization review process. She viewed these efforts as a direct attempt to politicize science and undermine the CDC's credibility. Her refusal to compromise on scientific integrity put her on a collision course with top leadership, isolating her within the very institution she was chosen to lead. After just 28 days, Monarez was forced out, her brief tenure serving as a stark warning about the vulnerability of public health leadership in the face of political pressure and internal conflict. The hope that Senate confirmation would insulate the CDC from politics has been shattered, leaving staff and the public questioning the future of scientific leadership. Instead, the episode exposes just how fragile scientific independence is in today's polarized climate, where even the strongest safeguards can be swept aside. Monarez's story is a cautionary tale for anyone who values evidence over ideology, a reminder that the fight for scientific integrity is far from over and that the stakes for public health have never been higher. Dr. Monarez's ouster triggered a wave of resignations among the CDC's most respected leaders, a coordinated act of protest that sent shockwaves through the public health community. The sudden departure of so many top scientists was unprecedented in the agency's history, raising urgent questions about the CDC's future. Among those leaving was Dr. Deborah Howry, the chief medical officer, whose expertise in emergency response and injury prevention had guided the CDC through countless crises. Also departing was Dr. Dimitra Daskalakis, head of immunization and respiratory diseases, a key figure in the nation's fight against COVID-19 and other infectious threats. Dr. Dan Jernigan, Director of Emerging Infectious Diseases, left as well, taking with him decades of experience in tracking and containing outbreaks. and Dr. Jennifer Layden, head of public health data, whose work was vital to understanding and responding to health trends nationwide, joined the exodus. These were not political appointees but career scientists, dedicated professionals who had devoted their lives to public service and the advancement of science. They were the backbone of the agency, relied upon for their expertise and judgment. Their departures leave gaping holes in vaccine programs, pandemic preparedness, and disease surveillance, threatening the CDC's ability to respond to future health emergencies. The message is clear. Conditions at the CDC have become untenable for those committed to science, integrity, and the public good. The loss of their expertise and credibility is a catastrophe for the agency, undermining trust both inside and outside its walls. This mass exodus is a self-inflicted wound that will take years, if not decades, to heal, as rebuilding such a deep well of knowledge is no easy task. The CDC is now leaderless and adrift at a critical moment, just when the nation needs its guidance the most. The resignations signal a crisis far deeper than a single leadership change, one that threatens the very foundation of the agency's mission. The agency's scientific backbone has been shattered, leaving a void that will be difficult to fill. The consequences of this upheaval will be felt for years to come, affecting not just the CDC, but the health and safety of the entire nation. The leadership implosion capped a year of turmoil at the CDC, marked by layoffs, budget cuts, and tragedy. In spring 2025, hundreds of staff were let go, weakening the agency's ability to respond to health threats. The cuts sent shockwaves through the workforce, leaving those who remained anxious and overburdened. Then, on August 8th, a gunman attacked the CDC's Atlanta campus, killing a police officer and shattering the sense of safety. The trauma from the shooting was compounded by another round of layoffs just weeks later. Staff criticized leadership's response as inadequate, feeling abandoned in their moment of need. The combination of layoffs, violence, and poor communication created a perfect storm of despair. The CDC, once a beacon of stability, was now in crisis from within. Morale plummeted as staff felt undervalued and unsafe. This was the fragile state of the agency when its top leaders vanished. The relentless turmoil at the CDC has devastated staff morale. Scientists and public health experts, once driven by purpose, now operate in fear and uncertainty. Layoffs and leadership chaos have left employees questioning whether their work is valued or if they're expendable. The campus shooting added trauma, turning a place of science into a source of anxiety. The timing of mass firings after the attack felt like a betrayal, deepening the sense of abandonment. Demoralization isn't just an internal issue, it weakens the CDC's ability to respond to emergencies. Innovation and collaboration suffer when staff are fearful and disillusioned. The mass resignations at the top are just the tip of the iceberg. The real crisis is the erosion of trust and purpose among rank-and-file staff. Rebuilding morale and trust will be a monumental challenge for any future leader. At the heart of the CDC's crisis is a battle between science and political interference. The conflict wasn't about minor disagreements. It was about who defines scientific truth and how it's communicated to the public. HHS Secretary Robert F. Kennedy Jr.'s skepticism of vaccines clashed with the CDC's evidence-based mission. Reports say Monarez and her team were pressured to support unscientific directives, especially around vaccines and autism, a theory long debunked. Staff pushed back, even signing a letter urging Kennedy to stop spreading misinformation. Tensions boiled over, with open displays of frustration inside the agency. When politics override science, public trust evaporates, and lives are put at risk. The CDC's credibility depends on its independence from political agendas. The stand taken by Monarez and her colleagues was a defense of science as the foundation of public health. Their departure is a warning. Science must guide decisions, not politics. Amid the chaos, Dr. Deborah Howery's resignation email became a rallying cry for scientific integrity. She warned that CDC science should never be censored or delayed for political reasons. Howery called out attempts to block the release of scientific findings that didn't fit a political narrative. She reaffirmed a core truth: vaccines save lives, and undermining this fact endangers Americans. Howery linked the spread of misinformation to a record-high measles outbreak, making the stakes clear. Her message was a call to action, a plea to protect the CDC's mission from political interference. Auri's resignation wasn't quiet. It was an alarm bell for the nation. She and her colleagues sacrificed their careers rather than compromise their principles. Her words are a historical testament to the fight for scientific independence. The CDC's stability affects every American, whether we realize it or not. It's our first line of defense against disease outbreaks, foodborne illness, and public health emergencies. The CDC's research shapes everything from restaurant safety to vaccine recommendations. When the agency is weakened, our health and safety are at risk. During crises, we need a trusted, science-based voice. Without it, confusion and harm follow. Political interference erodes the CDC's credibility, making it harder to protect the public. Trust is the currency of public health, and once lost, it's hard to regain. The recent turmoil threatens the agency's ability to do its vital work. The health of the CDC is directly linked to the health of the nation. With its leadership gutted, the CDC faces an uncertain future. The immediate challenge: a massive leadership vacuum and a demoralized workforce. Finding new leaders will be tough. Who wants a job where science can be overruled by politics? The agency's ability to respond to new threats is now in question. If political loyalty trumps scientific expertise, the damage could become permanent. The CDC's reputation, built over decades, is at stake. Yet this crisis could be a wake-up call to strengthen protections for scientific integrity. The statements from departing leaders have spotlighted the dangers of political interference. Rebuilding will take time, but the future of public health depends on the choices made now. The fate of the CDC and the nation's health hangs in the balance.